Ever wondered how ibuprofen works in our body? Well, let's start by understanding what ibuprofen is. It's a non-steroidal anti-inflammatory drug, also known as an NSAID. This means it's a tool our bodies can use to combat fever, pain, or inflammation caused by various conditions. Ibuprofen is quite the versatile medication. It's widely used by adults, but did you know that it's also safe for children over the age of 6 months? Yes, that's right. Of course, it's always important to consult with a healthcare professional before starting any new medication, especially when it comes to our little ones. So, we've established that ibuprofen is a non-steroidal anti-inflammatory drug used to manage pain, reduce fever, and combat inflammation. But how does it do all this? Well, stick around. Now that we know what ibuprofen is, let's delve into how it works. Ibuprofen has a fascinating mechanism of action in our bodies. As part of a group of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs, ibuprofen's primary function is to reduce hormones that cause inflammation and pain in the body. Think of your body as a highly efficient communication network. When you're injured or fall ill, your body sends out signals in the form of hormones that say, "Hey, we've got a problem over here." These hormones, known as prostaglandins, trigger an inflammatory response that results in pain and fever. Ibuprofen steps in like a switchboard operator, intercepting these signals before they reach their destination. By doing so, it effectively reduces the pain and inflammation caused by these hormonal messages. However, this doesn't mean that ibuprofen is a magic bullet. Like any medication, it comes with its own set of potential risks and side effects. One of the most significant risks associated with ibuprofen use is its potential to increase the risk of fatal heart attack or stroke. This risk may rise the longer you use ibuprofen, especially if you have heart disease or risk factors such as smoking, high blood pressure, or high cholesterol. So it's essential to use ibuprofen judiciously and under the guidance of a healthcare professional. Another potential risk associated with ibuprofen use is that it may cause stomach or intestinal bleeding. This risk is particularly notable in older adults, who may be more sensitive to the effects of NSAIDs. This bleeding can occur without warning and can be severe, so it's essential to be mindful of this risk when using ibuprofen, especially for prolonged periods or at high doses. Also, it's worth noting that while ibuprofen is effective at reducing pain and inflammation, it doesn't treat the underlying cause of these symptoms. It's like putting a Band-Aid on a broken arm. It might make you feel better for a while, but it's not going to fix the problem. So, while ibuprofen can help manage symptoms, it's crucial to seek medical advice for persistent or severe conditions. In conclusion, ibuprofen works by reducing the hormones that cause inflammation and pain in the body. While it can be a useful tool in managing various conditions, it's essential to be mindful of its potential risks and side effects. Always use the lowest effective dose and consult with a healthcare professional before starting or changing your ibuprofen regimen. So we've seen how ibuprofen works, but what should you keep in mind when using it? While ibuprofen is a common medication, there are some important things to consider before using it. Ibuprofen is a non-steroidal anti-inflammatory drug, or NSAID, which is widely used to reduce fever and treat pain or inflammation caused by a variety of conditions. But as is the case with any medication, there are important considerations to keep in mind. Firstly, it is crucial not to exceed the recommended dose of ibuprofen. It's easy to think that more medicine equals faster relief, but overuse can lead to serious health risks. Always aim to use the lowest effective dose to manage your symptoms. Secondly, ibuprofen is not for everyone. If you have allergies to ibuprofen or have experienced severe allergic reactions to aspirin or other NSAIDs, it's best to avoid it. Likewise, if you have specific medical conditions or if you are pregnant or breastfeeding, it's important to consult a healthcare professional before using ibuprofen. You may have heard that ibuprofen should be taken with food or milk. That's because these can help to lessen the potential for stomach upset that can sometimes occur when taking this medication. But did you know that food can also delay the absorption of ibuprofen? So, while it can be taken on an empty stomach for more immediate pain relief, if you're prone to stomach upset, you might want to have a little something to eat first. Storing ibuprofen properly is another important aspect of its use. It should be kept at room temperature and away from moisture and heat. This helps to maintain its effectiveness and prevent degradation. In the event of an overdose, immediate medical attention is necessary. Overdosing on ibuprofen can increase the risk of fatal heart attack or stroke and may cause stomach or intestinal bleeding, especially in older adults. Finally, remember that ibuprofen can interact with other medications. Always consult a doctor or pharmacist before combining it with other medicines. This is particularly true when considering other NSAIDs such as naproxen or aspirin. Despite their similarities, these medications are not considered interchangeable, and using them together can increase the risk of side effects. So, ibuprofen is a powerful tool for managing pain and inflammation, but it's not without its potential side effects. Like all medications, ibuprofen can have side effects and interact with other medicines. Even though it's a commonly used drug, we should never overlook its potential impact on our bodies. Let's first talk about the common side effects. It's not unusual to experience some degree of nausea or vomiting when taking ibuprofen. It's often recommended to take this medication with food or milk to lessen stomach upset. However, if these symptoms persist or become severe, it's crucial to seek medical advice. Bleeding too can occur, particularly in the stomach or intestines. This risk is especially heightened in older adults or those who use the drug long-term. It's essential to be aware of this, watching out for signs such as black or bloody stools, or coughing up blood or vomit that looks like coffee grounds. Dizziness and headaches may also occur. While these are often mild and temporary, if they persist or worsen, it's time to consult your doctor. Now, let's shift gears and discuss drug interactions. Ibuprofen may interact with other medications, potentially altering their effectiveness or increasing your risk for serious side effects. Some drugs that may interact with ibuprofen include blood thinners, corticosteroids, and certain antidepressants, to name a few. Before starting ibuprofen, it's vital to discuss your current medications and medical history with your doctor or pharmacist. They can provide personalized advice, helping you avoid potential drug interactions. It's always important to remember that while ibuprofen can be a helpful medication, it should be used responsibly and under the guidance of a healthcare professional. Ibuprofen, a common yet complex medication, plays a crucial role in managing pain and inflammation. To recap, this non-steroidal anti-inflammatory drug is a powerful tool for reducing fever and treating pain or inflammation resulting from a variety of conditions. Its effectiveness is rooted in its ability to reduce inflammation-causing hormones in the body. However, as with any medication, it's vital to use it responsibly. Remember, exceeding the recommended dose can lead to serious health risks such as heart attacks, strokes, and gastrointestinal bleeding. Always consult a healthcare professional before use, especially if you're pregnant, breastfeeding, or have certain medical conditions. And of course, never give it to children under 6 months old without a doctor's advice. Side effects can occur, including nausea, vomiting, dizziness, and headaches. It's crucial to report any side effects to a doctor, and to ensure ibuprofen isn't combined with certain medications without professional guidance. Thank you for joining us on this exploration of ibuprofen. Remember, knowledge is power, especially when it comes to your health. If you found this video helpful, join with our YouTube channel, Explained, and hit the subscribe button for more informative content like this.